In this video, I'll uncover the alarming symptoms of a potassium deficiency. Vitamins and minerals play a critical role in our overall health, and when deficient in these vitamins and minerals, we have a lot of symptoms that present. Unfortunately, what happens is a lot of people aren't familiar with these symptoms, and then they go to their doctor, and their doctor puts them on some sort of medication in order to cover those symptoms up. Of course, the unfortunate part here is that they actually didn't get to the root cause. They actually just went and got some sort of medication. And so that's why it's very important to understand this stuff and understand that there's certain vitamins and minerals that are more commonly deficient in people than others. One of those is going to be potassium, and that's why we're going to talk about the symptoms of a potassium deficiency. We're going to talk about what potassium is, the benefit it offers to the body, the symptoms as I mentioned, where you can actually get a good source of potassium for your diet, and of course the alarming symptoms of having too much potassium in your diet as well. So stick around to the end of this video, but before we get started, I'm Dr. Zyrowski and welcome to the channel. If you're new to the channel, it's a pleasure to have you here. Hit the notification bell and join our notification community, and I'm going to be able to help you excel your health and your life. So let's go ahead and talk about potassium first. I just want to talk about a brief overview as to what potassium is so that you understand the importance of it. It is the third most abundant mineral in the body. So first most abundant mineral is going to be calcium, second is going to be phosphorus, and third is going to be potassium. Now, this is, of course, one of the reasons that potassium is very important for our overall function of the body. It plays so many roles in many vital processes within the human body. Now, looking at the potassium, 80% of it is found in the muscle. And this is why you're going to find that when we look at potassium, it plays a huge role in overall muscle function. And a lot of the symptoms associated with a potassium deficiency play a role as to how your muscles are functioning as well. Now, it's considered an electrolyte. This is something that's important because a lot of people get confused. They're like, well, there's this mineral potassium, and then, of course, there's the electrolyte potassium. It's the same thing. A lot of people refer to it as a mineral outside the body if you were to buy a supplement or something. And then once it enters the body, a lot of people refer to it as an electrolyte, okay? Now, it's problematic when it's high or low. So a lot of people think of, well, if potassium's good for you, right? They read in some online blog or something, potassium's good for you, you should take more of it. Well, the problem is too much of a good thing isn't necessarily a good thing. And what I see happen a lot of times is people will have symptoms of having too much, which we'll get to in just a moment, but you'll also have symptoms of having too little. So we got to be careful about that. The recommended daily allowance is going to be 3,500 to 4,700 milligrams per day. Now, it's important to understand that if you're just living a normal lifestyle, let's say you don't really exercise a whole lot, let's say that you're just eating a good, healthy, whole food diet, you're probably going to be somewhere around 3,500 per day. Now, if you're someone who's following a ketogenic diet, low carb diet, you're doing a lot of exercise with a lot of sweating, you're going to be up towards this higher value. Okay, you're going to have to be in order to actually feel good, because as you'll see in just a moment, there's reasons associated with some particular lifestyles that will cause you to dump a lot of electrolytes from your body. Now let's go ahead and talk about the causes of the potassium deficiency, because, let me tell you, if you have a potassium deficiency, you'll feel pretty awful. We'll talk about the symptoms in just a moment, but it's not a good feeling. So when people have this issue, they wonder, why in the world did it happen? And one of the top reasons is going to be soil depletion. This basically means that due to over farming, that a lot of the soil is depleted, which in turn, we're not going to get as much minerals in our food, and we're also not going to get as many vitamins in our food. So due to the lack of vitamins and minerals in our food intake, we can have this depletion in our body. Exercise is another big reason. Okay, this is one of the reasons I had a potassium and just an overall electrolyte deficiency in general. I was training for Spartan races a couple years ago, and I was doing really intense exercise in the hot sun for about 2 hours. And so, of course, I was profusely sweating during this time. And of course, at this time, I was also following a low carb diet. And so put those two together, and that is a great way to get a potassium deficiency. And that's what happened to me. Now, if you're someone who's exercising, there's a good chance you're going to need more potassium in your system if you're sweating quite a bit, because you'll dump a lot of the potassium that way. And then low carb diet as well, because what happens with the low carb diet, a lot of sodium leaves the body and then the potassium follows. And so as a result, you will have a deficiency in a lot of cases. And so that's why I mentioned before that if you're someone who's doing exercise, low carb, you're going to want to be at that higher end of the recommended daily allowance there. Next is going to be poor quality diet. Okay, if you're just eating junk all the time, there's a good chance you could have one. Chronic diarrhea is a reason. Medications, there's a lot of different medications out there. I'm not going to go through them all. Just know that if you're on a medication, you could have a potassium deficiency. They're highly correlated. Medications and electrolyte problems, it happens quite a bit. Just talk to your doctor about that if you think it's an issue and you're having a lot of these symptoms. Kidney disease is a reason, and adrenal dysfunction as well. People who are under chronic stress and they have chronic fatigue and they're having adrenal dysfunction, this is a reason that you can have electrolyte imbalances as well. What happens is your cortisol is going to be all over the place, and when cortisol is high, it's causing your potassium to be low. And in many cases, what happens too in the problem of adrenal dysfunction is a lot of people say, I'm drinking water all the time, drinking lots of water, but it's just what can happen is just the way that these electrolytes function in the body. It can really cause a problem with how the electrolytes are entering the cell and how they're functioning and the balance, and as a result of that you can feel pretty terrible. So understand that, and I've seen a lot of people have electrolyte imbalances as a result of just chronic fatigue and adrenal disorders. Now let's talk about potassium deficiency symptoms. This is important, okay, because if you have a potassium deficiency, you want to know the different things you have to look for. First of all is going to be cramping. Remember at the beginning I said 80% of it's found in the muscle, so you're going to have a lot of muscular problems if you have a potassium deficiency, and you're also going to have a lot of muscle pain as well. Now, this muscle pain is going to just be like random pain throughout the body, not because you exercise very hard or whatever. It's just you're getting random aches and pains that don't necessarily make sense in the muscles. Weakness and fatigue. One of the best ways I can describe a potassium deficiency from what I experienced was it's like walking through water on a daily basis. I mean, you just have this feeling of something holding your body back. In every movement you make, it just seems like it takes so much effort. And so weakness and fatigue is a big one. Discomfort, irregular heartbeat. Now this is of course where it starts to get a little bit more serious, a little bit more alarming, because people can have electrolyte imbalances, potassium deficiencies, and have an irregular heartbeat. They run to their doctor and of course spend hundreds of dollars on testing, and it just turns out that they had a problem with potassium. Now, of course, if you think that your heart and your cardiovascular health is an issue, you should go to your doctor, get checked. It's very important to, but understand that this issue right here can cause irregular heartbeat. I experienced that as well when I had my potassium deficiency. Fluid balance, you can actually start to retain a lot of fluid, and so we want to make sure that if you're retaining a lot of fluid, you think about that too. High blood pressure is another reason. It's one of those reasons I talk about when people start to run to their doctor and then they get medications where they actually are covering up the symptom, but they actually avoided identifying the root cause of the problem, the blood pressure being high. When I had a potassium deficiency, I would notice throughout the day, just based on certain things that I did, as soon as I got done doing heavy exercise, or if I was to do a sauna session or something of that nature, what happens is my blood pressure would actually start to go high. And so, potassium deficiencies can cause that. It's a very common symptom. Mood changes and irritability. There's actually depression that is linked to potassium deficiency, so consider that as well. Now let's talk about how to get them, because it's very important to understand that most of the potassium is going to come from your food. A lot of people think that your electrolytes or all your minerals is going to come from water. Anytime I ever talk about drinking distilled water, because it's a very pure form of water, a lot of people freak out and go, you're going to cause an electrolyte deficiency. But if you understand electrolytes, you have to understand that most of them are not going to come from your water in the first place. Now, I personally live out in the country. I have a well. We have pretty bad water. So as a result, we go and we filter all of it. And if you even had electrolytes in there in the first place, it's going to take them all out if you're getting a good filtration system. Many people live in the city and they filter their water because it has fluoride and a lot of other chemicals, pharmaceuticals, that kind of stuff in it. And so as a result, if you go through a heavy filtration process in order to get out all the impurities, you take the electrolytes out. So there's a good chance you're not getting them from your water unless you're specifically drinking a spring water or you're buying an electrolyte infused water. So here's some foods that are really good in order to get some good potassium in your system. Beet greens, 1,300 milligrams per cup. Not the tastiest things unless you cook them just right, but they have a lot of potassium in there. White beans, 830 milligrams per cup. Avocado's a great source. 800 milligrams. A lot of people think that if you want to get good potassium, you got to eat the bananas. Avocado is a better source of that 800 milligrams. Coconut water is also a great source. Recently I had a massive headache, and I figured that it was actually due to a electrolyte imbalance and even a deficiency due to heavy exercise, sauna, that sort of thing. And what I did have available to me was coconut water, excellent source. And so for a lot of athletes who are trying to hydrate, this is a better option than utilizing Gatorade there or something that has a lot of sugar in it, or even utilizing a lot of the electrolyte drinks that have zero sugar but artificial sweeteners like sucralose in them. And so coconut water is great. Butternut squash, 582 milligrams per cup, great source. Spinach is a great source, and also sweet potatoes have 541 milligrams per cup. They are also a great source. White potatoes even have more, but a lot of people who follow my work, we try to stay away from white potatoes to a certain degree. So sweet potatoes are the better option there. Now let's talk about what happens when you have too much potassium, also known as hyperkalemia. And this is important because I find that a lot of people go out and they're going to stores and they're buying electrolyte powders, or maybe they read a blog online that was talking about electrolyte powders, so they start just pouring on these super high dose electrolyte powders, and they don't even know why they're doing it or understand the purpose behind it. They just heard it was good for them, so too much of a good thing, right? Well, as I mentioned before, too much of a good thing is not necessarily a good thing, because a lot of the same symptoms you have with too little potassium, you have with too much potassium. Tired and weakness, numbness and tingling, nausea and vomiting, and then trouble breathing. And this is where I actually had a patient who ran into this issue. One of the things that they were doing, they basically didn't tell me that they were adding in a ton of electrolytes because they thought that it was a very insignificant thing to mention. They were drinking a ton of electrolyte infused water, and as a result, their care just started to go off the rails. I was like, what's going on? Having a hard time breathing, palpitations, irregular heartbeat. Well, a month and a half after, doing all these different tests and going down a very insignificant road when it came to her health, it all came back down to she was drinking only a electrolyte infused water. As a result, her electrolytes were far too high. And a lot of people go and they get these different powders because, like I said, they think that, the more the better, and then as a result, they drive their electrolytes too high into their body. So we have to be very careful with that stuff. Chest pain is another thing that you can have happen as well. This particular individual had all of these right here, and it was very disruptive to their overall health. They were getting heart tests, they were getting tests for asthma, they were getting so many different tests, and it was too much potassium. And so we have to be careful with that. Put in the comment section below some of maybe the experiences you've had with too much or too little potassium. Share this video with your friends, and then check out this video over here that talks about all the electrolytes. We talked about potassium, but what about magnesium? What about calcium? What about phosphorus? All these other ones we mentioned. This one's going to talk about deficiencies and the importance of all of them. Check it out. Insulin levels stay very low, which flushes water from the body, which is going to deplete us of electrolytes.